It's the thought of being young when your heart's just like a drum, beating louder with nowhere to guard it.
When it all seems like it's wrong, sing along to Elton John and to that feeling we're just getting started.
When the nights get colder and the rhythm's got you falling behind,
Just dream about that moment when you look yourself right in the eye. Then you say, I wanna dance. The music's got me going and nothing that can stop how we move. Yeah, let's make a place and live just like we're golden and rolling like we're dancing fools.
we don't need to worry, just when we fall we know how to land.
Don't need to talk the talk, just walk the walk tonight.
Cause we don't need permission to dance. There's always something that's standing in the way, but if you don't let it phase you, you know just how to bridge us to the right vibe, yeah. Cause there's no looking back, there ain't no one to prove we don't got this on lock, yeah. The wait is over, the time is not, so let's do it right. Yeah, we'll keep going and stay up until we see the sun rise. And we say, I wanna dance. The music's got me going and nothing that can stop how we move. Yeah, let's break our plans and leave just like we're golden and rolling like we're dancing fools. We don't need to worry, cause where we from we know how to land. Don't need to talk the talk, just walk the walk tonight. Cause we don't need permission to dance. No, we don't need permission to dance.
Well, let me show you that we can keep the fire alive.
Cause it's not over till the summer. Say one more time. Say, I wanna dance. The music's got me going and nothing that can stop how we move. Yeah, let's break our plans and live just like we're golden and rolling like we're dancing fools. Like we're dancing fools. We don't need to worry, 'cause when we fall we know how to land. Don't need to talk the talk, just walk the walk tonight. 'Cause we don't need permission to dance.
Good afternoon, Hillmarks, Phoenix Garuda, lahat-lahat po ng ating mga subsidiaries na kasama natin ngayon. Magandang hapon po sa inyong lahat. And welcome po dito sa ating policy orientation regarding dito po sa ating mga health and safety protocols. Okay? So ngayong hapong ito, we're going to have a very quick reorientation lang, no? Because alam naman nating lahat itong latest na development dito sa COVID-19 na meron naman tayong panibagong variant na kumakalat, no? So that's why it's very important na tayong lahat ay aware dito sa mga health and safety protocols natin. Baka kasi medyo nakakalimutan na natin. Alam niyo na, baka nagiging relax na tayo masyado, thinking na wala na itong pandemic na to, no? But still, we have heard the news. Alam natin yung mga nangyayari, and we know that there is still this threat of COVID-19. So ngayong hapong ito, we're going to have a very short discussion lang para at least ma-reorient lang tayo dito sa mga safety and health and safety protocols natin, especially dito sa office. So I would like to take this opportunity para ipakilala sa inyo ang ating nurse dito sa main office. I'm sure familiar na siya sa inyo at palagi naman siyang umiikot, and palagi rin siyang of course nangangamusta sa lahat ng mga staff natin dito sa main office. So to give us a short discussion on our policy regarding dito sa ating mga safety measures natin dito sa main office, and even some of these are implemented in the project site. So I would like to introduce Nurse Vince.
Thank you, Sir Reso. So, dito po sa slide na to, makita po natin yung list of signs and symptoms that we need to watch out. So, pag nakakaramdam po kayo ng mga simptomas na to, we suggest that you do not report to work. And if ever you're going to report to work, please contact me or here in someone else here in HRD so that we can endorse you to our company physician for further instruction. So take a note for this sign and symptoms. So we also have daily monitoring of body temperature. So I believe everyone is already aware that for body temperature of 37.5 degrees Celsius and above, so we need to stay at the ground floor and wait for the guard to ask for the company nurse for further instruction. Pero we advise kasi di ba pagpapasok tayo sa office, nararamdaman naman natin sa katawan natin kung may lagnat tayo or wala. So kapag nararamdaman naman natin na masama yung pakiramdam natin or if we have a body temp sa bahay natin, pwede na tayo mag-check sa bahay natin. So kapag may lagnat tayo, so again, we suggest to not report to work na. So these are the need for a healthy body. So of course, regular exercise, physical activity, and at least 30 minutes daily physical activity. So here's the list of our the things that we can do for exercise. And we just have a new mandate from our HR manager that smoking is strictly prohibited in all areas of the building, including the front of parking area. This is a terminable offense. The HRD will release a memo regarding this.
Yes, because alam naman natin na yung smoking talaga is yan talaga yung nakakapagpa-deteriorate ng ating kalusugan, ano. And of course, kailangan talaga natin na the company really has to step in and implement measures, no, in order to keep everyone healthy. And part of this is the implementation of this very strict measure. I'm sure maraming magre-react, no, pero this is for our own health, no. Wala po talagang magandang maidudulot sa atin ito, and let us really cooperate, no, para gawin talaga natin na total smoke-free itong ating environment, no. Kasi po pag tayo ay naninigarilyo, talagang bumabagsak po yung immunity natin, and it's really not good. So siguro it's high time that we really implement this seriously. This is already being implemented in all project sites, no? Bawal po talaga doon ng smoking. So dito sa main office, we will strictly implement this. Dito po sa buong compound natin, bawal na po ang manigarilyo, even dyan po sa harap, sa parking. For as long as it is within the premises of the building, hindi po allowed, no? Ganyan po talaga. We have to do this, no? And this will also be implemented dyan sa Phoenix Garuda building natin, no? Dyan sa parking nila sa tapat, no? Bawal na bawal pong manigarilyo dyan, and this will apply to everyone. Okay? So this will be a terminable offense. maglalabas po kami ng memo, what will be the penalty for the first offense, second offense, third, and hanggang sa maging terminable offense na po siya talaga. So, as early as now, I am giving this information that smoking will be banned completely dito po sa atin, no, sa Hillmarks. And sa mga project sites nga po, kagaya ng sinabi ko kanina, ito po ay ini-implement na. So, sige, Nurse Vince, please continue.
Thank you, Sir Rezo. So still, we are going to continue doing social distancing and wearing face mask and face shield. We already know the benefits of this safety measures. It limits the contact or the spread of the virus. So here's are the pictures or images of our office doing social distancing while wearing face shield and face mask. So no hugs, no kisses muna tayo inside the office.
And let me just reiterate, no, minsan nagiging relax talaga na may mga nakikita po ako na hindi na nag-face shield, hindi na nag-face mask, no. If anytime po that you will have an interaction with a fellow employee, please make sure that you are wearing both your face mask and face shield. Kapag nakaharap lang po kayo sa computer ninyo at wala naman kayong kausap, wala naman kayong ano, pwede niyo pong temporarily tanggalin yung face shield ninyo, pero yung face mask po ninyo, it should always be worn at all times. Okay? So, except of course, kapag kakain kayo, tatanggalin nyo talaga yan. Pero, again, no, please bear in mind na every time that you will interact, you will talk with a fellow employee, you should wear both face mask and face shield, no? Kung nandyan lang po kayo sa table ninyo at ginagawa niyo po yung trabaho niyo at wala naman po kayong kausap, hindi naman kayo nagsasalita, enough na po yung face mask. Kasi po I understand na kapag kaharap niyo yung laptop ninyo o yung computer ninyo, mahirap din kapag naka-face shield pa, no? Yung glare and everything, baka sumakit po yung ulo niyo. So again, you only wear your face mask and face shield, both, no, is when you are interacting with a fellow employee. Pero kung wala pong interaction, always wear your face mask. Clear po tayo doon, ha? Clear po tayo doon sa policy na yun. Okay? Balikan ko lang kanina, Nurse Vince, no, yung nabanggit about sa temperature. Na-observe po namin na hindi naman 100% na check nung guard. So I am giving this instruction na yung pong mga guards natin, kailangan din silang ma-reorient, no, about these policies. Minsan nagiging relax din, no. Dati maski sino chine-check nila, pero as time goes by, habang tumatagal, nagre-relax. So kung hindi po kayo na-check ng guard, please on your own, no, i-check nyo po yung temperature ninyo. And if you register a temperature of 37.5 and above, please, no, stay there. Inform the guard kung hindi po niya alam, so that the guard will be able to call Nurse Vince and Nurse Vince will give you further instructions. So, yun po, ano, importante po yan, importante. At saka yung pong mga nabanggit na symptoms kanina, if you are experiencing any of those symptoms, please, wag na po kayong mag-attempt na pumasok. Please stay at home, inform your HRD, so that you will be given the necessary instructions, no? So wag na po talaga kayong pumasok if you are experiencing any of those symptoms. Sige, nurse, go ahead.
So like what we already I know you are already aware of with this, just the signage and color coding per floor. So I don't want to elaborate this anymore, but I'm going just like, because there are employees who are not are exempt for this color coding, the color black. So the the data privacy, the utility, canteen, ITB employees, as well as the supply officer, messenger, and driver. So they have the color coding of black, so they're the only one authorized to access multiple floors. So these are the color coding per floor. So for the second floor, we have the blue. Third floor is yellow. Fifth floor is brown. And we also have the elevator protocol and signage. And alam po natin na, aware naman po tayo na meron tayong alcohol at food bath doon sa entrance natin sa office. Please do use them.
Vince, i-emphasize lang din natin na yung color coding natin. Baka po nakakalimutan na natin yan. Baka po nakakalimutan na natin yung color coding, no? Please stick to your color codes. Dito lang po tayo. Kung sa second floor lang. Kung tayo po ay sa third floor lang po tayo. I believe yun lang pong mga utility personnel natin ang all access and even yung ating po mga IT, no? Na roving na nag-troubleshoot ng ating mga computer. Sila lang po yung pwedeng maski sa ang floors. So please, napaka-importante po nitong pinag-uusapan natin, no? Sa ngayon po wala tayong kaso dito sa main office, and let's continue to pray na sana ay wala po tayong maging kaso dito, kasi wag na po sanang maulit yung nangyari nung nakaraan, na napakarami pong tinamaan dito sa main office. I think 19 yung pong tinamaan dito sa main office. So please, wag na po nating isipin at wag na nating maulit sana yung ganong sitwasyon. Okay? And yan po, no, nakikita nyo ngayon yung alcohol and foot bath. I-revive natin. Ito siguro medyo natin, parang importante talaga is yung pag-disinfect natin ng ating mga kamay, no? At ulitin ko lang po, medyo may mga tumatagal na naman sa kantin. Okay? Hindi po tama yun, We will not tolerate that. Please be reminded, pagkakain, wag na po kayong magkwentuhan. So again, no, baka po tayo'y nalilibang na naman, nawawala na naman tayo sa focus. Ang kantin po, kain lang po tayo, after eating, let's go back kung sa ating mga workstations. Let's avoid interactions. Okay? So habang tumatagal po kasi, kaya talagang sabi ko, it's very timely, high time that we conduct this reorientation, kasi nagre-relax na po eh. Huwag po tayong mag-relax at huwag din naman po tayong mag-panic, no? So importante itong ginagawa talaga natin na reorientation. Sige Vince, continue.
So we also do regular disinfection of our offices. Pero on our own, di ba, pwede naman natin punasan yung table natin or yung station natin just for us to promote our own health and safety.
Eh, may mga available po tayo na may mga available tayo na mga alcohol, no? Importante po 'yan. So ito, I would like to discuss this, no, guidelines on penalties for offenders. Again, ayaw natin na pupunta tayo dito sa part na to, no? We don't want that to happen. Pero sana po ay hindi mangyari ito. Para wag na lang tayong umabot sa ganito, let us all cooperate. Let us all cooperate. No? Again, we don't want to penalize anyone for non-conformity dito sa ating mga protocols, pero sana po wag nang dumating sa ganito, no? This is for all of us. This is for all of us, no? So napakahirap kapag again tinamaan tayo dito sa main office. So basically ito po yung ating for the first offense there will be verbal reprimand, and then second offense written reprimand, 3-day suspension, 5-day suspension, fifth offense 10-day suspension, and sixth offense dismissal. Ito na rin po yung penalty natin for smoking, no? Ito na rin po yon. For the first offense, you'll be given your verbal reprimand hanggang sa umabot po ng dismissal. So please, no, yung mga tao diyan sa baba, wala po tayong maaamoy na sigarilyo diyan, no? And let's also be cautious dun sa ating mga sa ating mga ibang kasamahan na hindi naman naninigarilyo, and for all the drivers, take note of this, no? You are not allowed to smoke, okay? You are not allowed to smoke while on duty. Let's say, for example, may hinatid kayo, and then wala yung hinatid nyo, bumaba na siya, magsisigarilyo ka, tapos babalik ka dun sa sasakyan. Pagbalik mo sa sasakyan, amoy sigarilyo ka. Pag nag-report sa HR yung sakay mo na amoy sigarilyo yung sasakyan, you will be penalized for that. All drivers, I'm giving you this instruction. You are not allowed to smoke. Okay? No smoking for all drivers. We don't want to smell any smoke of cigars in the car. Hindi mabaho, no? Ang sakit sa ilong. So please, no smoking sa mga drivers natin. Wala nang maninigarilyo dyan sa baba. Absolutely zero smoking dito sa buong premise ng ating kumpanya. Okay? Next please, nurse. In counting the offense, it does not have to be the same offense, no? Pwedeng nahuli ko nung una sa smoking, then nahuli ka nung pangalawa not wearing mask, mag-ano po yan, magtutuloy-tuloy yan because all of these are included in our health and safety protocols. Okay? So any of the violations will be counted as one hanggang sa dumating sa pang-anim. I'm sorry, pero we have to implement these penalties. No? So again, we don't want to do that. So please cooperate. Okay? Please cooperate. Okay? Next, please. So yun lang po, no? Again, we are not yet out of this pandemic. We are doing this not to cause panic. Okay, we are not doing this to cause panic, but we are doing this because we want to be reminded, okay, of our duties and responsibilities in maintaining a healthy environment. Lahat po tayo may pakialam. Lahat po tayo may involvement. So yun lang po, no? Maraming salamat, Vince. Maraming salamat. Thank you, Vince.
Thank you, Sir Erso.
Thank you. May question dito kung binata ka pa daw. Yes po. Binata pa po si Vince, no? Okay, so maraming salamat, Nurse Vince, and thank you very much everyone for joining us this afternoon. Indeed, no? Napakalaking bagay po nitong ating ginagawang policy orientation because all of this will all boil down to us benefiting from these protocols that we are implementing. So let's continue to stay safe, okay? Let us continue to be always on the guard and on the watch. This pandemic is not yet over. We don't need to panic, but we have to be very vigilant. So let's all continue to stay safe and let us maintain a healthy and productive working environment. Thank you very much and God bless us all. Maraming salamat.